Hi, my name is Shelby Paul, and today I'm going to be delivering a speech on the path of a well-rounded therapist. And I have my boyfriend Neil here, and my audience, and my dad on FaceTime. Okay, let's get started. So, did you know, according to the CDC, 1 in 5 adults live with some form of mental illness? Even more alarmingly, 1 in 5 youth will struggle with a mental health issue that will severely impact their daily functioning. Mental illness is one of the most common conditions in the United States today, and its increasing numbers show just how important it is to seek help when you are struggling. One of the best ways to treat mental illness is to find a therapist who not only specializes in talk therapy, but one who also uses different techniques that can cater to each of their clients' needs. So this subject is very close to my heart because I am someone who has struggled with mental health for much of their life. And I've been seeing a therapist regularly for the last 5 years, and about 2 years ago, I started working with a therapist who practices EMDR. And she also specializes in somatic healing modalities. So for those of you who are unfamiliar with EMDR, EMDR stands for eye movement desensitization and reprocessing. And it's been shown to be an effective treatment for those who are dealing with trauma, and it uses eye movements to help process emotional pain. And through this combination of EMDR and other somatic techniques, I've seen the biggest improvement in my own life. And so much so that I've been able to stop taking an anxiety medication that I thought I would be dependent upon for the rest of my life. So through this personal journey, this has been one of the biggest inspirations of mine to make a career shift and to pursue a future in the mental health healing world. So with all this being said, I think it's safe to say I am very passionate about mental health, but this topic isn't just important for those of us who are wanting to become therapists. As I mentioned earlier, the odds are high that either you or someone you love will eventually face a mental health challenge at some point in their lives. So whether you're thinking about this as a career or just an observer in the audience today, I challenge you to find something valuable in what I have to say. Now let's discuss more about what a therapist's day looks like, specifically one that uses EMDR and somatic healing techniques, and how you would pursue a career in this profession. So a therapist spends most of their day listening to their clients, understanding their needs, and using their knowledge for mental health to guide treatment. After assessing a client's situation, a therapist can suggest different healing techniques. So for example, a therapist that specializes in more than just talk therapy, they could recommend EMDR, breath work, meditation, plant medicine practices, dance work, anything that helps a patient get into their body and process trauma and stress. It's also very important for therapists to take detailed notes on their clients. And if they accept insurance, it's very important that they manage the proper paperwork for that as well. It's a career that blends interpersonal work with administrative responsibilities. This job is unique because you can tailor your practice to the patients that you'd like to work with. So for example, you could work with adults who are dealing with anxiety, people who've been through trauma, adults who are struggling with OCD. You could also take a different route and work with families and children. The possibilities are broad, and you can choose what you specialize in to suit your interests and your strengths. When it comes to salary, according to crowncounseling.com, New York and California are actually some of the highest states for earnings for an EMDR therapist, which is great for us. And average earnings can start around $82,000, but can go up to $140,000 and beyond. Your income will be largely dependent on whether you have your own practice or if you work as an employee or if you work in a facility. Benefits will also be dependent on whether you're self-employed or if you work for an employer. If you are self-employed, you will need to get your own benefits. If you work for an employee, they'll most likely be covered. The outlook for therapists, especially those specializing in anxiety and depression, is very strong. according to an article on helpguide.org, the demand for mental health services continues to rise, sadly, and there simply aren't enough mental health professionals to meet the demand. So this means that for those of us that are interested in this field, there will be plenty of opportunities when we enter the workforce. So how do we get started on this career path? Becoming a therapist, particularly one who practices somatic work and EMDR, requires commitment to education and training. Dr. Elizabeth Brokamp of Gwynedd Mercy University goes over the steps in the article How to Become a Therapist on their website. So first, you'll need to get your undergraduate degree. Next, choose a master's program, and then complete the experienced clinical hours, and then pass the National Counselor exam. The exact requirements can vary state by state, but the process generally follows this path wherever you are. We have 2 doggies in here that are also very excited. Once licensed, the job market is wide open in San Diego. So, for instance, on Indeed.com, there are few job listings right now for a licensed psychologist and an LMFT, which is a licensed marriage and family therapist at places like New Youth Therapy and Family Services. Family Services for Integrated Pain Management Medical Group. So internships, which are also very important for gaining experience, are also very important, and I found a few available on LinkedIn.com, and there were a few at UCSD Health and HealthCore. So in summary, the path to becoming a therapist takes time and dedication, but it's a career that has not only financial stability and job security, but it also makes a difference in people's lives. So whether you're considering therapy as a profession, or if you just want to better understand the role therapists play in mental health today, I hope this speech has given you a clearer picture. And I want to thank you for listening to my speech today, and here's to a future with healthier minds and fuller hearts, thanks to all the dedicated mental health professionals out there. Thank you.